The discovery of pain relief, or anaesthesia, would be the third great barrier to be overcome.
What I find really bizarre is Victorian surgeons had access to a range of pain-relieving techniques, which they obviously chose not to use. Was it perhaps because they didn't work very well? I really want to know, so I'm going to try out a couple of these techniques on myself. I'm going to start with something which I am very interested in, but which I'm also deeply skeptical about: hypnotism.
We're going to be exploring how we can help to numb your hand during hypnosis, how we can deal with pain. First thing I'd like to do is find a baseline to measure it from.
Okay.
So what we're going to do is we're going to attach this, it's a peripheral nerve stimulator,
okay,
and we're going to put this onto your wrist. Let's put this about here.
And the person who's going to put me under is hypnotherapist Tom Mackay.
Just going to make all my... I'm ready.
Excellent. Okay, here we go.
Oh.
That's maybe
like
a little bit higher than...
No, that's fine. It's like sticking your finger in a sort of socket, you know, electric socket, when you get it. Let's try a little bit higher, okay?
Okay, we'll put it up to 30.
Yep. Okay. Oh, Jesus! Yes, that hurt. Okay, right.
Really, one of the things as well with hypnosis is it's not about being gullible, it's actually about being intelligent.
Okay.
So what we find a lot of the time is the more intelligent you are...
you're appealing to my vanity very, very successfully.
The deeper you can go.
Okay, well, I should be very, very interested to see what you do.
So just let your eyes relax completely. Every breath you take can help you relax deeper and deeper, deeper. Ever had the experience of what it's like to hold how cold your hand begins to come? Now. Press that button again. Very good.
That blast was 4 times stronger than I could cope with unhypnotized.
I'd just like to check to see if it'd be all right to increase that level one more time.
I don't know. It's sort of, it's bordering on unpleasant.
2 and 1 in your own time. You can take all the time you want to come right the way back to the room. Open your eyes, come right the way back.
Ooh. Yep. Ooh. It was impressive, because before I jumped, I really jumped, it really hurt.
Yeah.
I didn't jump, I noticed it didn't really hurt. But there's some level at which I'm just still curious as to whether, if it really hurt, if you were drilling into my teeth, whether I would be able to get to a deep enough level.
Your unconscious mind can allow any blood to stop.
So Tom once more put me under, and this time suggested I stick a needle through my hand.
No, it hurts.
Okay.
It started to hurt.
Part of the problem was that to stick the needle in, I had to first come out of my hypnotic state. Tom believes that with more practice, I'd manage it.
You'd hold on to that numbness.
It hasn't bled anyway.
No, it hasn't bled, so you can close your eyes.
To get into a deep enough hypnotic state to be able to ignore serious pain normally requires a lot of preparatory work, so it's not a quick fix solution.
Right hand, palm up, large helium-filled balloon.
I'm after something faster and more effective.
Now, alcohol is, of course, the traditional way of numbing the existential pain of life. But how well does it work when you're actually trying to numb the pain of pain? Here's one shot. I'm going to have a go until... Oh, that is so unpleasant. Could I have another, please? I can begin to feel the alcohol hit my system now.
I am not a drinker, and on an empty stomach it takes embarrassingly little to get me drunk.
2 vodkas, and about this time I feel like flirting. Hello. Sadly, the barmaid doesn't want to flirt, so instead I think what I'll probably do is induce some pain in myself for lack of anything else to do. Go on, how does that work? Here we go. Oh, no, wrong button. Right. Oh, God, that was still unpleasant. Okay, I think I probably need another vodka. Or another one. You're looking more beautiful than ever. Down the hatch. Oh, God, that's horrible. It still tastes as horrible as it did the first time around. Where was I? And I'm really quite intoxicated now, though I'm still able to say the word intoxicated, which is impressed. So where was I? Pain. I think I've lost the train of thought, whatever. But it was very interesting. For a brief moment there, it was extremely interesting. So, pain. Yeah, alcohol. Am I being coherent? I'm not sure. Am I being coherent, Gemma? Am I saying sense? Does it make sense? Perfectly, great, yeah.
What I was trying to say was we all have receptors in our skin which respond to damage and send the ouch message along peripheral nerves, up the spinal cord and into our brains. Alcohol depresses the brain so it doesn't respond so readily to the pain. Well, that's the theory.
It's probably a good time to give myself a bit more pain. It's this arm here. Oh, that is still very unpleasant. I'll just go up and see how it is. That is really, really quite uncomfortable. When I was being hypnotised, that didn't happen. All I can say at the moment is it's hypnotism 1, alcohol 0.
With both hypnotism and alcohol proving far from fail-safe, there was clearly a need for someone to come up with a better solution.